For those of you that are joining me here today, I want to thank you for joining me live. And if you're watching on the replay, thank you for watching. I'd like to start off by introducing myself. For those of you that don't know me, my name is Dr. Tamara Weinstein. I am the Director of Sales and Continued Education for Health and Nutrition. My background is as a doctor of physical therapy. I am a board certified clinical nutritionist. I've been in private practice and worked in a variety of different settings over the years. And in addition, I have been teaching as an adjunct professor at clinical faculty at New York Medical College. Going back since 1999, so about 22 years or so now, I think it is. And I have had the pleasure of working with Market America and the Nutrimetrics division of the company for the past 15 years, both as a Nutrimetrics health professional and consultant. And about 8 years ago, I started doing trainings out in the field for our amazing health and nutrition line, and then eventually as a certified Nutrimetrics trainer as well. So I have a love and a passion for teaching and education, and I am so excited to be in this new position to be able to share more education out in the field. For those of you that are interested in learning more, I'm a lifelong learner. So thank you for joining me today. Our topic for today is actually women's health, and May is actually Women's Health Month. So we are trying to go with different topics each month. And so we're going to get into a little more detail about women's health. And, just a little bit of background first, and then we're going to talk about some of our amazing health and nutrition products. But thinking about women's health and hormone needs, I think it's really important that people realize that things should be addressed throughout a woman's life. It shouldn't just be something that comes of a concern when a woman actually reaches menopause. So thinking throughout a woman's lifetime, we want to support things that relate to stress, that relate to sleep, that relate to sexual health, cognitive aging, and bone mineral density as well. I think it's really important to address all of these needs. And you guys can feel free to hop in the chat and share with me where you're from and your interests and so forth, because I'd love to hear from you all, and in the Facebook group as well. Feel free to make some comments as I go through today. I just think it's an important topic because 50% of women struggle with their hormones. And 60% of women report that they're sexually unsatisfied for one reason or another. And, there's a lot of information and technology out there, but we don't all seek that. I think many women accept things as normal. They accept that menstrual complaints, that gaining weight, those are normal complaints, that, changes in sex drive or low interest in sex, that's normal, or hot flashes or brain fog. All of these things are definitely common, but none of them are normal. And we can take into consideration throughout time to address some of these situations. Now, the liver regulates the balance of your sex hormones, of your thyroid hormones, your cortisone and other adrenal hormones. Optimal liver function is optimal mental, emotional, and hormone function. They're all interrelated. And vitamin and mineral supplements have been very useful for women to support a healthy monthly cycle, not just the circadian rhythm, not just supporting the adrenals, but those micronutrients, those vitamins and the minerals to give a woman the extra support that they might need. So what do we expect, or rather, what do we accept as we age? Well, we think of physical and emotional changes, right? And those often begin as early as in our 30s. We start to see that stubborn belly fat that, we're trying to lose. It's no longer responding to the changes in diet and exercise as quickly as it had been maybe in the past. Maybe when we're exercising, it's a little longer to recover from those workouts. Maybe our energy levels are decreasing. Sleep patterns can suffer, and many women complain of being exhausted in the morning or even throughout the day, whether we sleep well or not. That's often a big complaint that I hear on a regular basis. And of course, as we age, lean muscle mass starts to steadily decline. And so we're going to talk a little bit about exercise as well. So what influences healthy aging in women? Well, I think many women are more aware of a focus on estrogen, but I think it's important that we talk a little bit about progesterone as well, because low progesterone and only later the estrogen levels changing can account for many of women's experiences with complaints from things like PMS, irregular menstrual periods, sleep disruption, mood swings, hot flashes, complaints of vaginal dryness, and concerns with vaginal or uterine health as well. So it's the progesterone levels, the lower levels in the earlier years, that may cause some challenges as we age. And then of course, later we're a little more focused on the estrogen. So hormone production and bioavailability decline really as we age gradually. And that does cause changes in sexual function. It causes changes in metabolic health and energy and mood. And the progesterone, as I mentioned, can really start to decline as early as a woman's 30s. And, you know, it may be significant concern even earlier if she's had multiple pregnancies in her 20s. But unlike progesterone, which declines earlier, estrogen doesn't start to decline until a little bit later. So, you know, roughly 2 years prior to clinical menopause is where we really see that significant drop. But it's important that both hormones are considered relative to one another in order to understand that big picture of what our hormones look like and what they're doing. So estrogen dominance is a common hormone imbalance in women. And with this, we often see excess weight. We see things like insulin resistance, things in addition to stress, and we're all living in a pretty stressful environment, right? And it's just busy, crazy, multitasking, juggling lots of different things. All of these things can contribute to the severity of that estrogen dominance. So it's not necessarily that the estrogen levels are higher than normal. It's actually more than likely an imbalance of the ratio between the estrogen and the progesterone. And that's what we want to look at. That imbalance, sometimes even if it's only a small change, can be the reason for some of those symptoms that we were talking about. Things like PMS, bloating, irritability, cramping, things like that. So it could be just some minor changes in those hormones that we might want to consider taking a look at, because many just believe it's a natural part of aging. So the number one presenting issue in the female is actually complaints of premenstrual syndrome. Experts estimate at least 85% of menstruating women will present a history with at least one symptom as part of their monthly cycle. And I know many women will have, you know, certain times where they have more significant complaints than others. And then there's those women that have complaints, you know, as the, you know, month after month after month. So we really want to take a look at how we can offer some support here. Now, when we're talking about uterine cramps, the prevalence, 50% of reproductive age women report some sort of pelvic pain beginning shortly before their onset of menses or at the beginning of menstrual flow. And sometimes it's just the first day, the first 24 to 48 hours, and sometimes it can last a little bit longer. Women believe that those mood swings, bloating, you know, sometimes breast and pelvic discomfort, again, that they're normal. And they don't seek any assistance or guidance from their doctors because they just accept it, right? And that's what we want to talk about today, is offering some things so that we can take a look and see that certain symptoms we have, whether they're from, you know, PMS or whether they're from menopause, that maybe we can address and give some additional support. So some of the symptoms from menopause, things like difficulty sleeping is often, you know, a chronic complaint in women. They complain that they don't sleep well. That might be attributed to things like night sweats and hot flashes. Many women report changes in their mood, and this is often, you know, due to the significant shift in their hormone levels. Many women complain of increased vaginal dryness and sensitivity. And again, that could be changes due to estrogen, and that causes a thinning of the walls of the vagina. Some sex life changes, you know, and both physical and mental emotional changes really make can make sex more difficult. Some women even report that the onset of their changes in their sex life happened decades before menopause, the onset of menopause. And again, that might be due to some hormonal changes or that estrogen dominance that we were just talking about. When we take a look at cognitive function, the loss of estrogens at menopause, as I mentioned, can increase that central adiposity. So we start to gain weight around the middle. That tends to have an effect then on our metabolism, on insulin resistance, and ultimately on cognitive function. So individually and cooperatively, aging, menopause, adiposity, those can all impact cognitive function in a woman. Now, when we look at solutions, 40% of women seek out medical advice for management of symptoms, things like hot flashes, things like vaginal dryness, the night sweats, the sleep quality. About 40 to 50% of women have been shown to rely on the use of some sort of complementary therapy, maybe a plant-based supplement to support them through their life cycle as they go through changes. And again, it's not only when we're reaching menopause. We want to talk about even earlier in the years when we're experiencing issues with maybe PMS. We want to talk about providing some proper nutrition, because proper nutrition, things like vitamins and minerals, can play a positive role in relieving some of those problems of PMS. Things like vitamin B6, really all of the B vitamins are really important, because sufficient B vitamin status really plays an important role in the production of serotonin in our bodies. We need B vitamins to make more serotonin. Serotonin is what we refer to as our happy, feel-good hormone. But vitamin B6 and E in particular encourage the release of progesterone into the bloodstream and potentially raise progesterone levels through periods of depletion. So when we take a look at some of these nutrients, the deficiency or depletion in B6 and in things like magnesium, they can be common in women complaining of PMS. What's important to know is if we have an increase in the progesterone levels, that can actually have a relaxing effect and help to reduce some of the nervousness that some women might experience. So again, supporting the body to help to increase the progesterone levels could potentially be beneficial for women across the age span. Now, I do also want to mention for your consideration, besides progesterone, stress-related hormones, things like adrenaline, cortisol, those also have a direct and indirect effect on prostaglandin. Prostaglandins are the chemicals that can lead to the constriction of blood vessels. And so, by supporting this, we want to support the concentrations in the muscles and in the uterus as well. So here's a little pro tip for you. Exercise. It can increase both the blood flow and the endorphin production, which can affect the amount of prostaglandins, pain, and menstruation concerns that a woman might experience. So exercise can be extremely beneficial for women. And I just want to touch on fitness for a moment, because I think all exercise is important. And I think it's important, of course, within your health situation and your health goals, to get exercise in. So depending on where you start, you may want to seek out some advice from your doctor or from a fitness professional to get you started if you're someone who have not been exercising. But I want you to think about doing a combination of some strength training, which is really important, as well as some high intensity and some cardio. Like a combination is important to touch on all. But when we're talking about women and symptoms and things like that, I want to talk about just a few basic guidelines, because things change depending on where a woman is in her cycle. So in the first half of a woman's cycle, you might want to think about doing more high intensity training. Slower metabolism and increased estrogen levels, you tend to have more endurance and energy. So more high intensity training in that first half of the cycle. In the second half of a woman's cycle, the metabolism tends to speed up. You need more calories, there's more cortisol present. So doing some more basic strength training is probably the better time to do it in the second half of a woman's cycle because of the changes in the hormones during the cycle. So due to high cortisol, the high intensity interval training may stimulate fat storage and muscle wasting. Progesterone is vulnerable. So just thinking about where you are in your cycle, you might want to tweak and change your exercise routine to get the maximum benefit. But I do believe that we all need to incorporate some strength training for bone mineral density, healthy bones, building up of muscles and things like that as well. So would you be surprised to know that day-to-day stressors lower both our sex hormones, decreasing desire, as well as limiting our fertility? I don't think you'd be surprised to know that quality of sleep, not only for women, but really for both partners, is essential for stress reduction and balance of hormones, not just reproductive health. Chronic oxidative stress from our lifestyle, right? We often talk about the need to supply our body with antioxidants to balance out the oxidative stress, whether it's from the outside environment, the air we breathe, the soil that our food grows in, right? Things like that, or whether it's from the natural inside creation of free radicals, which occurs when we exercise and things like that. Those, we don't want to stop those are important, but we want to counterbalance that. We want to counterbalance that with proper nutrition, because the oxidative stress from lifestyle factors and from poor nutritional habits really can affect everything from pregnancy all the way down through healthy brain aging. What about testosterone? I think many women are familiar with taking a look or asking questions about estrogen. Now you know the importance of that balance and that ratio of estrogen to progesterone. But I also want to touch on testosterone, because testosterone is important for women as well. It's both estrogen and testosterone that help keep bones strong. Estrogen levels tend to drop abruptly at menopause, and many women, as I said, are familiar with thinking about replacing it. But testosterone really should be evaluated for its benefits in women as well, because there could be an imbalance there. So I like to mention that when you're going to get medical advice and seeking out professional advice, it's not only the estrogen levels, but it's the progesterone and the testosterone. When we're talking about testosterone, I want to point out that vitamin D could be helpful, because low levels of vitamin D correlate with low levels of testosterone. So of course, we all know that we want to get out in the sun every day, 30 to 60 minutes of sun per day. The early morning light is, in my opinion, one of the best times to go out and get some of that bright sunshine if you can, and preferably sun without some sunscreen on it. And that's why early morning sun is a little less strong for the UV lights. But getting that in through there. And then I think it's really important to supplement with a vitamin D3 as well, because many individuals, it's difficult to get those levels up even when we're out in the sun. And we all know that, right? So you want to keep those optimal levels somewhere between that 40 and 60 range. If you do not know your vitamin D levels, I do highly recommend that you next time get your blood work done, that you request, if it's not already in the panel, to get your vitamin D levels checked. My personal preference is to be up at that higher end of the 60 because it offers more benefit, in my opinion. I don't want just the bare minimum. I want to optimize. So thinking about lifestyle factors, thinking about getting in those calcium rich foods, right? Those green leafies, lots of colorful vegetables, of course, but green leafies, especially for their extra calcium in those certain vegetables. We want to think about supplementing with vitamin D3. Of course, I mentioned the B complex and the magnesium intake to help support healthy progesterone levels. If you smoke, please quit. We all know that's not healthy or good for you. You want to reduce the amount of alcohol consumed. Of course, we talked about the need to exercise and increase, especially the strength training, the high intensity, and you can coordinate it as where you are in your cycle. Thinking about improving posture, we're sitting all day, keeping a healthy body mass index, that's an important thing. Eating healthy, exercising, maintaining a healthy weight. Really, we also want to talk about these last two. We want to make sure we have a healthy gut. Having a healthy gut biome can affect our overall body systems and our overall health, as well as treating cardiovascular and endocrine goals, because that is important for many women, especially to pay attention to those things. So we're going to go in and talk about some support that we can consider taking depending on where you are and what your own personal health goals are. But before I go into any product, I also always have to share our disclaimer, right? The statements that I'm going to share with you have not been evaluated by the Food and Drug Administration, and the products that I'm going to discuss with you are not intended to diagnose, to treat, to cure, or to prevent any disease. We're talking about offering support to the body, offering balance to the body. That's really key here. We're not looking to treat or prevent anything. So we're going to just talk and start at the beginning, and the beginning is with conception, right? So talking about preconception health, often thought of as women's health before she becomes pregnant, but this is really a misconception. It's not only the woman's health, it's really the health of both individuals that play a role in the neurologic and metabolic health of the pregnancy, as well as in healthy fetal development. So we're talking about both individuals, both parents, eating a good, healthy diet, eating healthy food, living a healthy lifestyle, managing that stress, getting a good night's sleep, and making sure that they're supplementing where the diet falls short, and to support the body systems to give them the support they need for those specific targeted health goals. All of these factors have an impact on preconception health for both individuals. Now, the studies have shown that there is a definite need for comprehensive micronutrient support for women during preconception as well as during pregnancy. And it's not only the folic acid alone, because I think that's the common knowledge, right? Women, before they even try to conceive, should start a supplement with folic acid. But it's not only the folic acid, it's things like all of the B vitamins, it's vitamin D3, it's magnesium, it's the essential fatty acids, it's things like alpha lipoic acid, vitamin E, and other antioxidants. And I just want to make a notation here. When we're talking about folic acid, we want to talk about the activated, or what we refer to as the methylated form, because many individuals have a hard time with putting that folic acid into a form that their body can actually utilize. So we use things, you'll see on the slide here, it says 5-MTHF, that's a methyl tetrahydrofolate. And you'll see in some of our products, it's referred to, and I'll talk about it on a later slide, as a trademarked ingredient called quattrofolic. Now, when we're talking about prenatals, I think many women have a difficult time. There's a lot of challenges in making supplements acceptable, as it is across the board, but prenatal, I think, might be one of those up at the top, because many women, when they are pregnant, have a difficult time with the smell or the taste or the ability to swallow. Maybe some vitamins can cause irritation to the stomach, or pass through, the stomach quickly, and they're really not getting the efficient absorption. And so they end up sometimes with symptoms like reflux, nausea, things like that. And so we want to talk about some things that this company has done to go above and beyond, like it does with all of our products, right? I always talk about quality control. This company gets the best ingredients from the best sources, and the products are formulated based on the science and the research to give us the best quality product. So when we break down and look at the ingredients here, we have trademarked ingredients that were clinically researched and studied in all of our products. So you'll see in a number of our products, but we're starting with the prenatal here, you'll see things like quatrefolate. And as I mentioned, that's the metabolically active folate that is used by the body for cell division, for growth, for neurotransmitter formation, for energy, for detoxification. And that's what you'll find not only in our prenatal, but in a number of our other products. In this prenatal, you will also find Sun Active iron. Sun Active is another trademarked ingredient. It is an iron that is non-irritating, and it has superior properties and increased bioavailability without having some of the negative effects on the GI tract, causing things like constipation, which is really important when we're talking about the utilization of a prenatal vitamin. And then we have magnesium in the glycinate form in here, which makes it more bioavailable and helps support healthy bones, teeth, joints, and skin. So again, taking the trademarked ingredients, the best ingredients from the best sources, and formulating the products based on the science, the clinically evidence studies to bring the best product out to market. And that's what you'll find in our Isotonix prenatal multivitamin. This is, again, in the isotonic delivery system, it makes it simple and easy to drink. Many women have a difficult time swallowing those pills, and again, having those side effects of the nausea and so forth from those pills sitting in the stomach. So we have the benefit of the isotonic delivery system and the formulation to provide the vitamins and the minerals that are essential for normal growth and development of the baby. This is a product that helps maintain normal blood pressure during pregnancy. Healthful diets containing adequate folate can reduce a woman's risk of having a child with a brain or a spinal cord defect. And that's why we need to have the extra folic acid. And in this particular product, that methyl tetrahydrofolate, or the trademarked ingredient quatrefolate, is so important to decrease those risk factors. This is a product that helps promote a healthy birth weight of the baby. Deficiencies of micronutrients have been shown to cause low birth weight. So we want to make sure that we are getting enough in the diet, of course, through foods first and foremost, and then adding in the supplement for those extra vitamins and minerals that we have an increased requirement for during pregnancy. And while we're on this topic of pregnancy, I did want to share our well-being tea. Now, this is a functional tea that contains herbs that promote health benefits. It has some vitamins, minerals, antioxidants in there. And there are other functional teas that I think many people enjoy drinking, like green tea, black tea, and red rooibos. But this is a tea, this is a whole leaf tea that actually has a number of organic, high quality ingredients like lemon peel, ginger root, spearmint leaf, licorice, ashwagandha, which is a botanical that is a calming and soothing, chaste tree berry, raspberry leaf, as well as that red rooibos in here. And what makes this unique, and the reason why I put it here right after our prenatal, is because this company considered pregnant and breastfeeding women when they formulated this tea. It combines a unique blend of those botanicals, and each was added in adequate amounts to support well-being and health. And again, added it here because it was considered in the formulation to support pregnant and breastfeeding women. So anybody who's interested in enhancing, you don't have to be pregnant or breastfeeding to drink it. By the way, I enjoy it, and I am 4 children, youngest at 15 going on 16. So no longer pregnant or breastfeeding, but I do enjoy this tea because there are health benefits to it. So it can help promote energy and vitality. And, you know, many individuals like athletes and busy people, parents on the go, anyone seeking natural ways to obtain mental clarity and tranquility would benefit from enjoying this tea. It is really, in my opinion, very refreshing. It's got that balance of botanicals to help you keep up with your demands of the day. So I wanted to include it here as well. Now, I think it's really important that every woman could use more natural energy. I'm sure you can all agree. If you agree that we can all use some more natural energy, put it in the chat for me, because I know I'm not the only one. So show a little love and support. I think we can all use it, right? So when we're talking about some more natural energy, we're talking about reaching a balance with a mixture of different vitamins, different minerals, and antioxidants as well. But not only which ones, but also in the right combination is important. So a woman's body has unique needs based on her age, her weight, and her physical fitness. Listen, we all want to look good and we all want to feel good, right? And it doesn't matter if we're talking about preconception or pregnancy and breastfeeding, or we're talking about, supporting things like PMS or menopause, or even getting a better night's sleep for that matter. We all can use a little natural energy. And I wanted to share this next product with you because this is one of my favorites. This is our Women's Health Isotonix Essentials. And this is that product that has that right balance of vitamins and a certain powerful number of minerals in there, in combination with those antioxidants to give women the extra support that we need. And so, you can all take a look at the label here. And for those of you that are joining me that might be guests and you're interested in learning more information, please go back to the person that invited you to watch this little lunch and learn and ask them for some more information, because I'm sure they would be happy to provide it for you. Now, in this product, we do have some of our vitamins. We do have some B vitamins in here. Of course, we do have some of those trademarked ingredients that I was just talking about. And because it's isotonic, just like all of our isotonics, there's no soy, no yeast, no artificial flavors or preservatives in here. And, you will see a number of those vitamin, minerals, and antioxidants, those OPCs, along with hyaluronic acid, which is beneficial for our skin health. So I mentioned the quatrefolate before. That's that methyl tetrahydrofolate, and that is the trademarked ingredient that puts that B into, or the folic acid into, the active form for those of us that have a difficult time. So the quatrefolate completely bypasses that conversion step where our bodies need to take the folate and put it into a form that the body can use. I mentioned that sun active iron in our prenatal. You will find it here again in our women's health formula. And it's in here because iron is really an essential nutrient, and it's often lacking in the diet, not only for infants and women of childbearing age and pregnant women, but even as we age, even men often are in need of supplementing with an iron. So the Sun Active, this trademarked ingredient, as I mentioned before, it has a gentler effect on the GI tract because it is more soluble. It has less of an iron taste. It is a sustained release, so our body receives more usable iron per dose, over a steady level. So the iron's maintained in the blood, and there's decreased precipitation. So you have a higher bioavailability, and it's easier on the stomach and on the GI tract. Then, of course, we have our trademark pycnogenol, or our pine bark extract, which is an amazing ingredient in many of our different products. And it's in so many of our products because there's so much research that exists that talks about the benefits of pycnogenol. And it's no different that, pycnogenol has multiple benefits when we're talking about women's health. The benefits here on pycnogenol alone are for healthy aging, healthy skin, vascular support, joint health, cognitive health. The link between hormonal shifts in aging and cardiovascular health are connected here by pycnogenol, because pycnogenol can affect many different of our body systems, as well as our skin. Whoop, too fast on that clicker there. So our Isotonix Essentials Women's Health supports a healthy complexion. It promotes healthy functioning of the skin down at a cellular level which of course could result in rich, vibrant looking skin. It helps maintain normal cell health, healthy collagen production. It provides that antioxidant protection for the entire body, protecting from free radicals, right? We talked about the need to support the detoxification pathways. We talked about the antioxidants to balance out those free radicals to protect the body. This is a product that helps support healthy bones, teeth, joints, and skin, helps maintain normal muscle and nerve function, supports a healthy immune system, supports cardiovascular health, promotes cognitive health, and again, gives women the extra energy that we need to get through our busy day, the extra vitamins, minerals, and antioxidants that we need. My personal preference is to take this product at night before I go to bed. I am a big fan of either the Daily Essentials or the Anti-Aging Isotonix Essentials in the morning. And our Women's Health Isotonix Essentials is my personal preference to take at night because it replenishes some of those B vitamins. It replenishes some of the calcium and magnesium, which need to be offered in a split dose. And so that is why I personally choose to take this one at night. But again, it doesn't have to be, that's just my personal preference. Now, when we're talking about menopause symptoms, 40%, and I think I mentioned some of the statistics earlier, about 40% of women seek out medical advice for management of their symptoms like hot flashes and night sweats, changes in sleep quality. And when we look at, the complementary and alternative therapies, the categories that they really focus on for management is the biologically based categories. So things like botanicals, herbs and botanicals, vitamins, minerals, amino acids, of course, healthy diet, food first, as I always say, but also things like mind body, right? Things like energy therapies, manipulative types of therapies could be beneficial, as well as whole medical systems, things like Ayurvedic medicine. So there's many different things that women seek out. And, we've been talking a little bit about vitamins and minerals, but I want to talk a little bit more about some of those botanicals because those can be beneficial for support as well. And so in our next product, which is our Prime Feminine or our female support formula, you will find a number of different herbs or botanicals in here, in addition to some B vitamins, which we already discussed the importance of. So I'm just going to highlight a few of them. We don't really have time to get into all of them, but we're going to take a closer look at just some of those leading actors. And the first one that I wanted to touch on is black cohosh. And traditionally, black cohosh was used as a remedy for hot flashes associated with menopause, and used for PMS as well. This is a herb that contains triterpene, glycosides, isoflavones, alkaloids, and phenolic acids, which have this phytoestrogen activity. So low estrogen levels can be linked with some symptoms. And again, the imbalance that we talked about before, but that black cohosh may help alleviate some of those mild symptoms of menopause. It was shown in the studies to help reduce the number of hot flashes, supported quality of life, limited total menopause discomforts, and helped reduce night sweats. The second one is the dong quai, which is often referred to as the female ginseng because of its supportive benefits during menstruation. And it has been most commonly used for mild cramps and discomfort during menstruation, as well as to alleviate some of the mild symptoms of menopause. And it does this not by having an effect on the hormones per se, but rather by supporting normal blood flow, which allows the tissues to be responsive. The next one is the chasteberry, which I mentioned earlier in our well-being tea. This is a shrub native to the Mediterranean and Central Asia, and it's used often in dietary supplements for helping to maintain normal levels of female hormones and mild menopausal concerns. Chasteberry has a tendency to selectively bind to the beta estrogen receptors, which in turn can help alleviate the mild symptoms of menopause. So it's been used for supporting uterine muscle, helping with mild symptoms of PMS, and promoting mood and well-being. Then we have wild yam, which has been used historically for symptoms associated with menstruation and menopause, things like cramping, hot flashes, and occasional fatigue. The wild yam saponins are currently thought of as a hormone precursor in the body's normal manufacture of progesterone. And we talked about the importance of potentially increasing the progesterone to balance out those hormones, right? And that's important. The saponins are also linked to promoting healthy cholesterol levels by promoting normal triglyceride and supporting healthy levels of your HDL. Now, the soy isoflavonoids are phytoestrogens. They're non-steroidal, but they have estrogen-like biologic activity, and they do come from plants. They're often used in dietary supplements for alleviating mild menopausal concerns. They do have a weak estrogenic and anti-estrogenic effect, so it helps to balance out some of those mild symptoms of menopause. And they may also be linked to promoting bone health and female well-being. And then we have the Tribulus terrestris, which was traditionally used in Ayurvedic medicine to promote optimal blood circulation. And it has been shown to maybe help maintain normal hormonal balance. We have valerian root in this product as well, which has been shown to help reduce mild PMS symptoms, difficult sleep, mood, or emotional sensitivity as well. So that is another botanical in this particular product. So our Prime Feminine has all of these botanicals with the B vitamins that work in synergy together to help reduce hot flashes and night sweats associated with menopause, helps alleviate mild symptoms commonly associated with menopause, helps stabilize mood, may help maintain normal hormonal balance, can help counteract mild effects of PMS, help maintain optimal female health. So the Prime Feminine, you can see, often would be beneficial to consider taking with things like our Bliss or even our TLS Axe, right? With those adaptogens in there to help support stress. We do have our Prime Time Performance for men as well, because the next thing we're going to talk about is sex. If we can help reduce the stress, maybe women can enjoy sex more. And so going into our next product is our sexual health. And, you know, when we're talking about sexual health, we're talking about interest and desire. And what can affect that? Well, stress for one. And so we want to manage that stress. As I mentioned, we have some amazing products like our Bliss or our TLS Axe to do so. We want to, you know, improve our health and reach our targeted health goals. We want to get a good night's sleep, eat a healthy diet, and emotional well-being plays a role as well. There's definitely differences from men to women. Men seem to be more concerned with stamina and erectile dysfunction, while women seem to be more concerned about desire or interest. And the studies show that about 52% of adults report being dissatisfied with their sex lives. Thinking if 52% are reporting, how many did not report, right? So I think that number is quite a bit higher than that. But it is a concern that many, you know, women, men as well, but many women really do have a source of distress over because of changes that we may experience as we go through our lives. Now, sex drive can be determined by levels of hormone. It could be affected by the environment, which is why we need to, you know, think about supporting those detoxification pathways and taking those antioxidants. Of course, psychologically, stress, confidence, things like that will have an effect on our sex drive. Social factors, you know, getting a good night's sleep, all of these things are things to consider. But we do want to think about the ability to support through lifestyle and botanicals, right? So thinking about getting a good night's sleep, managing that stress, eating a good healthy diet, getting in the exercise, and looking at botanicals, things like ashwagandha, which you'll find in our Bliss or our TLS acts. Things like the Tribulus terrestris, fenugreek, the red Korean ginseng, those types of botanicals have been shown to offer support for this. And so these are some of the ingredients in our next product in our Isotonix sexual health formula. So the Tribulus terrestris is a general tonic for energy. It's been used for general vitality, and the research shows that when taking it, it seems to support libido, sexual desire, and helps maintain normal sexual function, both in men and women. And this is a product that we're discussing here in female health or women's health, but I just want you to be aware that this is a product that was created for the use for both men and women. So you will see, I am including men here, even though we're talking about women's health today. The second botanical in here is fenugreek, which works to support sexual drive, arousal, and libido. And it has been shown in the research promise for supporting sexual function, sexual drive as well. And then, of course, we have our trademark pycnogenol in here. And that's in here because this is a ingredient that has been shown to promote the normal production of nitric oxide. Nitric oxide, increase in nitric oxide helps to open up and vasodilate those blood vessels so that the blood can flow freer through. We need good blood flow to all areas of the body. We need good blood flow to the genitalia, right? So pycnogenol is an excellent factor for promoting sexual health and wellness in both genders. Then we have red Korean ginseng in this product as well. And this is an adaptogen that also helps with normal nitric oxide and dilation of those blood vessels to help the blood flow. But it's also an adaptogen to support the body directly dealing with those mental and physical stressors, which can help promote physical as well as mental performance here. So in this Isotonix sexual health, we have those 4 botanicals in there, which work together in synergy to promote sexual wellness, to support a healthy libido, meaning interest as well as desire, normal sexual function, normal blood flow to the genitals, normal nitric oxide, which supports the blood flow to the genitals. And this is a product that should be consumed on a daily basis. This is not a product that you take when you need it. This is a product that you take daily to give you those desired benefits for increased desire, for increased arousal, interest, and libido. And a healthy libido, in my opinion, is important to any intimate relationship, right? So this is, again, a product that can be taken both by men and women and should be taken daily to get the maximum benefits discussed for this particular product. I couldn't help but include our Isotonix ORAC in here. I think this is a product that often gets overlooked. This is an amazing product, and I think many women can benefit from this product. It is mixed berries, and these berries contain bioflavonoids, organic acids, polyphenolic compounds, and these all work synergistically together to fight that free radical damage. It's important because I don't think we get enough in our diet. I don't think it's possible to consume enough of these types of nutrients that give us the benefits of these plant-based antioxidants, which are necessary to get down inside the cell. So ORAC is composed of a powerful blend of blueberries, raspberries, cranberries, grape, elderberries, chokeberries, blackcurrant, pomegranate, plum, prune, and things in addition to these powerful blend of berries is you will find vitamin C and E, which is a natural tocopherol, as well as bioperine, which is a black pepper extract that promotes the bioavailability of certain nutrients, certain antioxidants, to get the absorption into the lining of the cell, into the small intestine. So again, just like all of our amazing products, they're formulated with the right ingredients, with the right amounts, with the right delivery system to increase the bioavailability. Now, the CDC and the NCI recommend 1 capful of ORAC actually supplies 300 ORAC units, which is what is recommended. And this is a comprehensive antioxidant network with great diversity for the ingredients that's included. Again, increased bioavailability due to that black pepper or the bioperine in there. Antioxidants help with inhibition of oxidation of the LDL cholesterol. The LDL cholesterol, or what we refer to as the quote unquote bad cholesterol, has an affinity for the coronary arteries. And some of these powerful plant-based antioxidants help support or inhibit the oxidation of that LDL cholesterol in the coronary arteries, which is really important for cardiovascular health. And this is a product that supports a healthy immune system, cognitive health, and it has a high ORAC at 3,000 units per capful. So a great product that I often think many women or many individuals forget about, but it's one that should be considered adding into the daily routine as well. Some other products to also consider when we're talking about women's health. I think it's really important. Well, I mentioned the vitamin D3 with K2 earlier is important, not only for testosterone levels, but for overall health and immune health. Omega-3s are really important. We talked about magnesium and B. We have individual isotonics that we can supplement with. But curcumin extreme is another product that I would not go a day without. It's one of my other favorite products. So many health benefits in terms of support for liver health, for cognitive health, works down in the mitochondria for cellular health. Just one of my absolute favorite products. And then, of course, we have our new Pure Collagen Plus, which is our grass-fed collagen with 10 grams of collagen, which was an upgrade from our previous. So some additional products that I think women might want to just take a closer look at. I'm not saying you need to take all of them. You can prioritize to what fits your needs best, what fits your targeted health goals best. But we have so much to offer within our line that I thought it was really important to share with you what we have. Now, some additional recommendations for well-being. I mentioned earlier, you want to cut back on that alcohol, you want to clean up on that diet, you want to get some additional sleep, get a good night's sleep, you want to support detoxification, right? You want to work on your nutrition, your diet, your gut health, really important. You know, nutrients can support hormones by helping metabolize them. So giving the micronutrients, the vitamins, the antioxidants that we've discussed. Make sure you go for some strength training and resistance training to build up that bone, the bone density, your bone mineral density, as well as building some muscle mass, which decreases as we age. So I want to just say thank you so much for joining me today for our little lunch and learn talk on women's health. I appreciate you joining me, whether you're here with me on Zoom or with me live on Facebook or watching the replay. Thank you so much. I appreciate it. And I look forward to joining you again in the near future for our next topic. Thanks and have a great day.